Okay, everyone. So now we're going to talk about Chapter 6, Overview of Nursing Informatics. So our objectives: define nursing informatics and key terminology. We're going to explore nursing informatics metastructures, concepts, and tools, and reflect on the science underpinnings of nursing informatics. We'll describe phenomena of nursing as well. So key concepts in nursing informatics. Nursing informatics centers on the concepts of data, information, and knowledge and wisdom. Nursing informatics is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom. So basically, we're using nursing science and all that computer stuff we just talked about, and how we disseminate our nursing knowledge out and better improve practice. So what is the goal of nursing informatics? So nursing informatics is going to support consumers, so people who use healthcare, patients, other nurses, and other providers in their decision making in all the role and settings. And you notice that when you look at your EMR, you have all these different tools that help better patient care and also help you communicate with other disciplines in healthcare, whether it be dietary by picking someone's diet or setting the order for somebody's diet, whether it's trends in people's vital signs and the doctor can access it, or even consumers or patients looking at your MyChart. And the goal of nursing informatics is to improve the health of populations. We look at trends, communities, helping us figure out how to target a certain area of town, families, better access and information on the level 1 status, and individuals by optimizing information management and communication. Nursing informatics is one example of a discipline-specific informatics practice within the broader category of health informatics. What does that mean? It means nursing informatics is a specific area within health informatics, and it's very well established within the nursing science. It's been recognized as a specialty for registered nurses since 1992, which is nuts. So focus of nursing informatics: it provides representation of nursing data, information, knowledge, and wisdom. Nursing informatics assists in the management and communication of nursing information within broader context of health informatics. So what are the metastructures of nursing informatics? Well, let's talk about data. Data are discrete entities that are described objectively without interpretation. We talked about this before. It's raw information, vital signs, a picture of a wound, audio of lung sounds, descriptive words, crackles, murmur, tangential, right? They're just raw information that without other context you can't interpret. So then how do we use this data? Well, we process it as information. It's raw data that becomes interpreted, organized, and structured. So, you tell me someone's pulse is 120? Great. What was it 2 hours ago? What was it in 5 minutes? What was their blood pressure? All that raw data is going to get interpreted and organized. We organize it in charts. We organize it in graphs in our minds. And we structure it so that we can process information. And then what becomes of that information? It's knowledge. It's information that's synthesized to identify and formalize a relationship. Okay, somebody's pulse keeps going up and their blood pressure keeps going down. We're going to formalize as a relationship to what? To shock. And so next we'll implement our wisdom. Appropriate application of knowledge to the management solution of a human problem. Why is this person going into shock, right? Are they losing blood somewhere? Are they septic? What else are you going to look at? What raw data will you then look at to impart wisdom for this person's shock? Maybe their temperature, maybe a urinalysis to look for leukocytes in their urine, maybe a CBC to see if their H&H is dropped. Maybe we should just actually assess the patient and see if there's any blood pouring out of anything, correct? Are they cold and clammy? Are they awake? Are they breathing? Or are they standing up and talking on the phone with their friend? This is important information that has to become knowledge that becomes wisdom. So let's look at an example of DIKW. Okay, so data, information, knowledge, wisdom. Data, vital signs for an individual's heart rate, respiration, temperature, and blood pressure. Information, a serial set of vital signs taken over time, placed into context and used for longitudinal comparison. Knowledge, recognition of a pattern and identification of interventions, reflects information synthesis based on nursing knowledge. And wisdom, accuracy of the synthesis of information and appropriate selection of intervention. So how do we go from knowledge to wisdom? Knowledge focuses on what is known. Wisdom focuses on the appropriate application of that knowledge. So for example, a knowledge base may include several options for managing an anxious family, while wisdom would guide the decision about which of these options are most appropriate for this specific family. So let's delve into this example. I am an anxious wife, and there are, from your knowledge base, different ways to deal with an anxious wife in the waiting room. However, your wisdom, as an anxious wife, that maybe I already lost a first husband to a car accident, and now we're in the hospital and we're waiting for someone to undergo surgery, and I've seen somebody die in the hospital. Are you going to maybe choose a different option to calm me down versus an option that you would use for somebody who's anxious and has never lost someone to surgery or lost someone for a medical accident? Right? So that's how you go from knowledge to wisdom. So let's look at the scientific underpinning for nursing informatics. So it's a combination of nursing science, which we've talked about, information science, computer science, and cognitive science to manage and process nursing data, nursing information, nursing knowledge to facilitate the delivery of healthcare. So it's very specific to that whole nursing idea that we talked about, promoting health, looking at the whole person. The combination of these sciences creates a unique blend that's greater than the sum of its parts, a unique combination that creates the definitive specialty of nursing informatics. So, structured language as a tool for nursing informatics. Nursing knowledge is gained by the ability to extract data that specifically defines nursing phenomenon. Many different languages and ways of organizing data, information, and knowledge create difficulties in mapping nursing phenomena, right? We have lots of words for different things: circling the drain, crumping, coding, crashing. So that's something we have to figure out. The ANAs formalize the recognition of different languages and vocabularies through a review process of the Committee of Nursing Practice Information Infrastructure. And you're like, oh my gosh, Denise, that sounds so boring. It might be, but we want to make sure that we're all speaking the same language, so to speak. So at a higher level of structure, several resources have developed to facilitate the interoperability between different types of systems, concepts, and nomenclatures. Meaning, okay, you're a travel nurse. You worked with Epic, now you're working with Centricity. Then after that, you're going to NextGen. You need to know how to be able to pick up on these EMR systems based on very similar systems, concepts, and nomenclatures. Nomenclatures meaning common words for a certain area. The importance of developing universal language and vocabularies cannot be understated. So as an informatics nurse specialist, you have to attempt to envision the differing functions that could be used with data, information, and knowledge so that you can disseminate it into a structured standard language tool for nurses. Concepts and tools from information science and computer science. Informatics tools and methods from computer and information science are considered fundamental elements of nursing informatics. Information technology includes computer hardware, software, communication, and network technology. It's derived primarily from computer science. Concepts and tools from information science and computer science, that's like information structured organized data, knowledge for processing by computers, information management, and it's an elemental process within informatics. So the human-computer interaction. All right, that's basically our usability and ergonomic concepts, right? So how easily is it for everybody to use this EMR? How easily or how much damage or maybe eye strain, maybe your wrist hurt because you're typing all the time. Elements of human-computer interaction have to be rooted in psychology, social, physiology, and cognitive science, and it's important. What's the point of making a program to improve health if somebody doesn't use it right and it hurts them in the process? So usability issues address efficiency and effectiveness of an application, because if not, you're not going to go back and use it. Human-computer interaction and related concepts. So human-computer interaction, usability, and ergonomics are related concepts, typically subsumed under the rubric of human factors of how human and technology relate to each other. If someone can't use a program, they're not going to use it. They're not going to like it, and they're not going to try and help other people use it. So your optimal task completion includes the concept of efficiency and effectiveness. And you have to also consider the safety of the user. So make the program efficient and effective. Find the knowledge gap so that someone finds it efficient and effective, and make sure that it's safe for somebody to use. I know you think, how, Denise, is an EMR dangerous? Well, how is using a computer dangerous? You can hurt your neck, your wrists, your eyes, so you have to protect the person using it or they're not going to use it. Human-computer interaction. So in the past 5 years, the number of human-computer interaction usability publications in healthcare has increased. And vendors are installing usability laboratories and incorporating usability testing, other products into their systems life cycles. Usability testing should be a constant theme when implementing informatics into healthcare. Finding out if it's effective, if it's efficient, is it usable, are you improving, are you hurting people by using it? That needs to be done constantly, not just once and every 3 months, but always worked into the system's life cycle. So the meta paradigm of nursing comprises 4 key concepts: the nurse, person, health, and environment. Nursing actions are based upon the interrelationship between the concepts and are related to the values nurses hold relative to them. Nursing decisions. The decisions that nurses make can be characterized by both the quality of decisions and the impact of the actions resulting from these decisions. The process of decision-making in nursing is guided by the concept of critical thinking. And critical thinking is the intellectually disciplined process of actively and skillfully using knowledge. Nurse decision-making. Nurses make decisions about potential problems presented by an individual, about appropriate recommendations for addressing those problems. And decisions also may occur within specific environments, such as executive offices, classrooms, and research laboratories. Decision support systems are great because they're typically rule-based and they help go down an algorithm to help people make decisions. They use the specified knowledge base and a set of rules to analyze data and information and make recommendations. Hey, your patient's last A1C was 5.9. They're pre-diabetic. You should put pre-diabetes in the problem list. You should recommend a weight loss clinic. You should recommend a diet referral. You should give them the following information. You should check their lipids. You should check their thyroid. What was their last blood pressure? Do we have a waist circumference documented? These expert systems provide decision support to implement the knowledge of one or more human experts so that we can do more with each patient and find out more to help people live healthier, longer lives. So wisdoms in informatics. Wisdom is informatics is the ability of the nurse informatics system to evaluate the documentation drawn from a health informatics system and the ability to adapt or change the system setting or parameters to improve the workflow of the clinical nurse. Nurses' decision-making is described as an array of decisions that include specific behaviors as well as cognitive processes surrounding a cluster of issues. So what is the future of nursing informatics? The future of nursing informatics promises increased saturation of informatics, concepts, and solutions into mainstream nursing and healthcare practices. As informatics solutions become a common tool as a stethoscope, each nurse may be considered in part an informatics nurse. New materials and concepts will evolve in the future. So here are some thought-provoking questions. How is the concept of wisdom in nursing informatics like or unlike professional nursing judgment? Can you create examples of how expert systems can be used to support nursing practice?